Hello and welcome back to the Personal Transformation Experience podcast. Today, talking about something very personal for me, somatic symptom disorder, which is a mental health condition where a person feels significantly distressed about physical symptoms and has abnormal thoughts, feelings, and behaviors in response to them. The disorder disrupts their daily functioning and quality of life. And although a person with somatic symptom disorder reports symptoms, the symptoms may have no medical explanation or be normal body sensations or discomfort, even when there is a medical cause, because there can be.
Yeah.
People who have somatic symptom disorder aren't faking their symptoms. They may actually have real symptoms of illness, pain, suffering, even other things that may show up in urine or stool, all kinds of things. But what we're talking about here with somatic symptom disorder is the worry is out of proportion to the symptom, right?
Right.
So we've all, like, take for example, you had too much to drink and the next day you have a severe headache and you might vomit, right? Mm-hmm. Now, you could go to the emergency room and say, I think I have cancer and I'm dying. Right. Or you could realize I'm a jackass and I drank too much last night, right? So somatic symptom disorder is when you go way too far over. So like if you think about that meter, I have something making me sick, but it's not going to kill me, but I'm all the way over here in the red on the meter thinking I'm dying. Mm-hmm. That's kind of connected to this.
Right.
But people that have somatic symptom disorder, they're typically unaware of the underlying mental health condition that's driving that, and they actually really believe that they have severe and serious physical ailments. Now, we're not saying they don't have a physical ailment. It's the severity of the ailment in the person's mind is what we're talking about.
Right.
The distress will cause them to visit multiple healthcare providers, and they may have many medical tests and unnecessary procedures because they don't believe the diagnosis they've been given. So they may have lab workups, blood workups, CAT scans, x-rays, all kinds of things. And somebody might say, hey, you have this, you have an irritable bowel, let's say, for example, and the person believes they have cancer, right? And they think you haven't done enough testing, or you haven't done the right testing, or you're not the right doctor, and so they get obsessed.
Let me ask a question. Is it the same as when somebody has, is constantly like has little aches and pains or feels things throughout their body and sort of perseverates on that?
It's connected to that.
Let me just finish. When they are constantly like, something's wrong, like I feel this, I feel that, I have a pain here, I feel like, my heart's, like they start really focusing on everything that's going on in their body, and they're avoiding what's actually happening, or they're trying to avoid doing it. It's like an avoidant behavior. So they're avoiding some other mental health issue or something else that's going on in their life that they don't want to look at. So they focus on all these physical symptoms.
I think you're getting a little ahead of what I was going to tell everybody about regarding this, but I think you're kind of getting into the why behind the somatic symptom disorder. So hold that thought, because I think you're definitely 100% on the right track.
Yeah.
But I just wanted to make sure that for those watching, because I thought it was important to set the table for what we're talking about here today, what this means, and I think it's going to be important to get into the what and the why, and then we're going to look at a personal story or two that I have about it personally, and to try and make those connections. But some of the interesting things I found in my research, and by the way, we'll post the research and the sources in the notes. A lot of this came from Cleveland Clinic and National Institute of Health and other research I did. But, and by the way, this is a relatively new DSM-5 disorder, this mental health condition that was updated in 2013, so only in the last dozen years. And before that, they might have called it somatoform disorder, hypochondriasis, I believe. So a lot of different things, but now they're kind of up under the umbrella of SSD, again, somatic symptom disorder.
Yeah.
So, and women, by the way, interestingly, are 10 times more likely than men to have this. The physical symptoms that people with SSD feel are going to be related to pain. That is, by and large, always comes up. Pain, fatigue or weakness, and being short of breath. Right? So, but what the distinguishing hallmarks of somebody with somatic symptom disorder are going to be the level of anxiety they feel about the physical symptoms.
Yes.
And I think we've all known people that have had things. I've known people that are really ill, but I've read stories about people with the same level of herniated disc, right, in their lumbar spine, right? A lot of people have that. I have that. And they're incapable, they're on disability, right? They can't work, they can't move, they can't walk. And you have other people that have the same herniated disc and they're out running, they're lifting weights, they're going to work, right?
Yeah, I mean, I don't really know why that is. And what's interesting to me, like you could have somebody who totally identifies with some kind of illness. And I'm not a psychologist, I'm not, a PhD or anything, but there's something going on there where they feel the need to identify with whatever's going on. Like I am, I don't know, like I am depressed, right? Well, you could be sad for a long time. Well, I'm sad because I'm depressed. Like, and around you go. I mean, I've heard this before, and, but then you want to, what can you do about it? Nothing? I'm depressed. That's just what I am. Like I'm accepting that I am depressed and this is what I am. This is my life. Like, and they don't do anything to get better, or it doesn't appear that they will do anything to get better. Like, they get stuck in this loop.
Yeah.
Somebody who, I have a herniated disc, so my back is going to hurt. I can't do certain things. I can't exercise because I have a herniated disc in my back and it causes me pain.
Right.
So,
and that's not necessarily what I'm talking about here.
Yeah.
What you're talking about is people have kind of given in to actual real physical issue that they have.
Yeah, it's a real physical issue, but they give in.
I'm talking about here, again, to be clear, and we're not talking about people who are malingering or making up a condition. They actually
have a real issue,
wrong,
yeah.
But their amount of concern, level of anxiety over it is through the roof. Mm-hmm. And is still in that level of anxiety may or may not be justified, right? There are people who know that they have a terminal illness and they're at peace, and they're doing all the things on their bucket list. And
right, they do whatever they want.
Right?
Yeah.
And they're not freaking out. They don't need to be strapped to a bed because they're hysterical, right? So it's really the mind-body connection here, and we'll talk about that again in another podcast, because people who have adverse childhood experiences, traumas. Those do manifest in real physical illnesses, and that's not what we're talking about here today. We're talking about people who have real feelings of physical illness, but their anxiety or anxiousness about it is disproportionate to what's going on. So I just want to make sure everybody understands the difference, because
but that anxiety can take shape in different behaviors, right? So you may not outwardly look like you're freaking out, but you will be thinking about it nonstop, talking about it nonstop, calling everybody you know and talking about your illness.
Well, it's to the point where that's one of the other hallmarks of it, where somebody is unable to function, right? They have so much anxiety, they're obsessing about it, they're looking up symptoms all the time, talking nonstop, they're waking up in the middle of the night thinking about it, searching on the computer, and then become so dependent on others for care that they get angry when somebody's not fully attentive to them and their needs.
Yeah.
So it is somebody. It's kind of like off the chain, right? Anxious about
or
what's
trying
happening.
to self-diagnose.
But again, I want to be clear. What we're talking about is people that have real feelings about real things, and they're not faking it. This is not.
No, it's a real thing. But their anxiety is, they're feeling like, they have a pain, they have a headache, I have a tumor, right?
Well, so that's more where you're like going to the nth degree with something, right?
Yeah.
And then you're convinced you have a tumor. You go to the doctor and they say, you don't have a tumor. We've done a CAT scan, we've done MRI, we've done all these tests. Yeah. There's nothing there. You still believe that the CAT scan and MRI missed something.
Right, yeah.
Right? So that's an example
of that. But that's somaticizing.
So why? What causes it, right? So let's go into that, because you started talking about that a little bit. People who were victims or suffered childhood physical and sexual abuse, right? So their body was violated in some way. They had poor awareness of their emotions, or emotional development might have been stunted during childhood. And this can be the result of, and this is a very critical point, parental neglect or a lack of emotional closeness. So if they had a parent who was distant, they weren't attached to their parent was preoccupied, so forth, those are types of things. That neglect is a big root, and I'm going to get really into a great example of this later.
Yeah.
And as a child, it may have excessive anxiety and attention to bodily process and possible signs of illness. I heard here I heard here, I think, hey, you know, a 7-year-old going to their
Can
mom
you just
thinking
say
they have
that
a tumor.
again? What you just said, but slower.
Excessive anxiety and attention to bodily processes and possible signs
Excessive anxiety and attention.
of illness.
Oh,
Right.
or tension or attention.
Attention.
Okay.
Yeah.
Sorry, it wasn't clear, and I'm trying to.
Like some people might, right? You might be running and say, you know, my calf is tightening up.
Yeah, yeah.
And somebody might freak out and call an ambulance, right? Thinking they're having a heart attack, right? Or you might have, like, say you have a little pain here. So let's say you had a cup of coffee and an omelet, and then you decided to go for a run right after.
Or you get a stitch.
And you get a pain here, and all of a sudden you call an ambulance, right? Now, I don't want to discourage anyone who has chest pain from calling an ambulance,
Right.
But if you know this happens every time you eat
Right,
and then run
yeah, you get a
afterwards,
stitch, yeah.
you probably have a stitch, or you have,
Right.
you know,
I've gotten many of those.
it's not a heart attack, right?
Right.
It's probably not, especially now if you're somebody who, I'm going to be very specific here, right? A month ago, you went to the hospital. They did a CT angiogram. They did an echo. They said you wore a Holter monitor, and then you go out for a run right after drinking a cup of coffee and have that pain and call the ambulance again. That's where it's probably excessive because you've already been checked out. You have no heart issue. Your heart's clean. Your arteries, zero calcification. You have no reason to be having a heart attack. You just were checked out weeks before, and you have the pain again.
Right.
So that's kind of what.
But I mean, I actually had I was checked out because I had a real thing.
I'm not. This is not directed at you or anybody.
I mean,
I'm just trying to
they actually did
clarify.
find something, but I'm okay.
Trying to give people a clear example.
Yeah.
So it gets diagnosed when your doctor or healthcare provider does a physical exam and other tests to rule out conditions causing your symptoms, or maybe identifying something as simple as, hey, you have GERD, so you need to take some type of medication, right, to settle the acid in your stomach.
Yeah.
So you're not having a heart attack. You're having GERD. You're having upset stomach. But if you may get referred to a mental health provider if you're not seeing somebody. But to be diagnosed with SSD, you must have one or more symptoms that cause distress or disrupt your daily life for at least 6 months.
Yeah.
You must have excessive thoughts, feelings, or behaviors in response to symptoms that meet at least one of these following criteria: overly excessive and long-lasting thoughts about the severity and seriousness of the symptoms, continuously high levels of anxiety about health or physical symptoms, an extreme amount of time and energy focused on physical symptoms and health concerns. So spending 15, 20 minutes a day researching or trying to educate yourself on something the doctor told you about a potential cause of your pain is not extreme. If you're spending the entire day and you're up all night and you can't go to sleep, or you're waking up at 3 a.m., checking the computer, and you're calling people and you're checking yourself into the hospital, those are all things that would say it's excessive and extreme. How do you treat somebody? The Cleveland Clinic recommends CBT. I would say the parts therapy here is very good because I would say there's probably something going on with your parts trying to protect you from something.
Right. There's a part that's experiencing pain, and they are trying to... What happens is you have a part that's experiencing pain, and the reason why that part is experiencing pain is because they want you to avoid anything that's going to cause the pain. So if it's experiencing pain, it thinks you're going into doing... That part is trying to protect you from doing something that could harm you.
Like let's say you're a kid getting bullied at school, right? So this part of you then develops, right, to say, okay, I actually have... My stomach hurts. I have a fever. You don't go to school.
Right.
And this part now then kind of records that, okay, I can get out of the situation of going to school.
By getting sick.
Right. And you don't pretend to be sick. You actually are.
You actually are sick.
I think it's important we talk about the risk factors for developing this, right? Somebody's too attuned to their body sensation. So if they hear rumbling in their stomach, instead of it just interpreting as hunger, they think that they have, some type of intestinal virus, right? So you're misreading your physical cues.
Right.
If you have a history of substance abuse disorder, alcohol use disorder, being neglected as a child, being abused physically and sexually, having a chaotic lifestyle and trauma at home, having chronic illness during childhood,
right,
and having certain personality disorders as a child also will all lead people to get to this. It's not usually diagnosed that early in childhood either. So I think that's a good topic. We should hold that and look that up for next time. But this is something that's chronic. It doesn't mean it's not treatable. I don't know that it's always curable, because somebody may kind of fall into that pattern, and that might be a time to kind of revisit the therapist. But this is why it's important, if you do have somatic symptom disorder, you have a good relationship with a primary care provider that you trust,
Right.
and who will communicate with you, right? Because you don't want to be jumping from one provider to the next, and every time it's Groundhog Day, they start over again. And then have therapy, IFS therapy. I know we both love that. So in going through all of this, when I was doing the research, I was reminded of a story my mother told me years ago when she was alive, about her mother when she was a teenager. And very interesting dynamic. My mother was an only child. There were periods where her father and mother wouldn't talk to each other. Her mother wouldn't talk to her, or her father wouldn't talk to her mother. Her father wouldn't talk to my mother. So this dynamic is people like shunned each other in the household, right? They ignored and neglected each other in the household. So at one point, my grandmother, I guess, was so ill, she felt like she was hurting all over. She couldn't stand up. She had fatigue, all these things, and she laid in bed for weeks, according to my mother. If my memory serves me correctly, doctor came in. They ran every test imaginable. They couldn't find anything wrong with her, and the doctor said, "You're in perfect health." And apparently, she got out of bed, put on her house coat, went in the kitchen, made dinner, and then cleaned the house, and then never talked about it again. So, don't know, right? Was that somatic symptom disorder?
Right.
And then I think about when I was 11 years old. I went to go from living with my mother to living with my dad and my stepmother. And it wasn't because I wanted to do that, but my mother was living with an abusive man who she wasn't married to, who hit me and threw things at me. And so naturally,
You want to get the hell out, yeah.
I wanted to get out of there, right, and go somewhere else. So I thought, let me go to my father and stepmother's home, loving home, and maybe things would be different.
Loving home.
But nonetheless, I was very sad. I mean, I was 11 years old. That's a hard time to go through, leaving your mother, going to your father and stepmother's house. They had just married. They had just had a baby. Everything was new and changing. And I remember going with them on a trip and getting ill. And I had stomach aches and pains in my chest, and my muscles hurt, and I had a fever in the low 100s, and they brought me to the doctor. And the doctor tested me, did blood work, checked me out, can't find anything wrong. But they asked me to leave the room so they could speak to my father and stepmother. And I could faintly hear through the doorway, because the door wasn't shut, I was out in the hall, the doctor going, when someone says they have pain here and here and here, and you got to wonder, is it all in the head? And, and then my stepmother was like, okay, nodding along. And afterward, it's like, there's nothing wrong with you. You've got to, grow up, get yourself together. And then anytime I felt I was ill, I couldn't talk about it because I would get ashamed for it. Like, you're not sick. There's nothing wrong with you. You're going to school. There's nothing wrong with you. So the premise, and even I spoke to my father recently, he was implying that I have some abdominal aches and pains right now that we're checking out, but he was implying that maybe it was all in my head, so that...
So you're still doing it.
It hasn't changed, and so hold that thought, right? I didn't feel validated.
Right.
I didn't feel seen or heard now over this physical illness. Now, and this is going to be the last story I'm going to tell for the sake of time. So my grandmother passed away when I was 34 years old. Now, I was very close. It's the same grandmother who I talked about a few minutes ago. I was very close to her. She cared for me when I was younger. She had a very clean home. She was meticulous, probably a little OCD, undiagnosed. But I always felt safe with her. I felt protected. I felt cared for. I felt listened to. I felt heard. I felt protected. All the things that a child wants, I felt like I got from my grandmother. So she died when I was 34 years old. And all of a sudden, I was like, I'm on my own. I don't have this rock in my life anymore.
Yeah.
And I remember at the time I was working constantly. I was picking up side jobs, and I was so stressed out, and I felt like I couldn't do enough. I couldn't be enough, wasn't good enough. And one morning that summer, within like 6 weeks after she passed, I woke up with excruciating pain in my left back, my left upper back. And I thought I pulled my shoulder out or something. I didn't know. And this continued. And my wife at the time, my ex-wife, we went on vacation. It was so bad while we were on vacation that we went to the hospital. They did a chest x-ray, and they said, Mr. Brand, you have pneumonia. Now, it seemed absurd to me at the time because I had no coughing, no shortness of breath that I was aware of, and didn't have a lack of energy or anything. Right. I just had this severe unrelenting pain. I thought they were going to tell me that my shoulder was dislocated. That's really what I thought was happening. And
yeah, but you didn't do anything to make that happen. Like, you dislocate your shoulder, you know.
I was going to the gym every morning.
Yeah, but if you dislocate your shoulder, you know.
I didn't know. I've never dislocated my shoulder, so I didn't know.
It doesn't happen that easily.
Okay, well, I didn't know you then to give me that opinion or advice. Thank you very much. So
I know I did it.
We got back home. They gave me antibiotics and got back home, went to my doctor. He does another chest x-ray. He says, oh, my God, your lungs are more infiltrated than they were last time.
Oh, my God.
I'm going to put you in the hospital. He put me in the hospital, put me on more antibiotics, another chest x-ray, more antibiotics. This went on and on. Finally, they do a CAT scan because I'm not getting better, right?
Right.
Even though I don't understand because I was living in Queens, New York at the time. I walked everywhere. I could walk 4 miles fine, not out of breath or nothing. And I'm like, how could I walk and have pneumonia? He goes, well, it's called walking pneumonia, which I don't think that's what that is. But I'm like, I don't think that's what that means, that you can walk 4 miles and not be out of breath and have walking pneumonia.
Yeah,
so
no.
Anyway,
yeah.
I was like, what?
That doesn't make any
sense. What doctor
sense.
is this? So ultimately, they did a CAT scan because nothing. I was on 4 rounds of antibiotics. Nothing's changing. Mm-hmm. They do a CAT scan. And they said, Mr. Brand, you have swollen lymph nodes throughout both lungs. And you either have lymphoma, it sounded freaking scary at the time, or you have sarcoidosis, which I had never heard of. Now, computers and doing Google searches, I don't even know if we had Google back then.
No, probably not.
It was the year 2000.
Yeah.
But, I had a Merck manual, so I started looking up.
Right.
I looked up sarcoidosis, looked up lymphoma. I'm like, oh no, lymphoma's not good. You probably need radiation. I'm like, I hope it's not that. But ultimately, I started developing other symptoms. Now I started feeling a shorter breath. Now I started getting more aches and pains in my body. And one day on the way to work, it was like my whole body froze up like I was in a vice. Everything tightened up.
Right.
Right. But again, I was getting really anxious by this point. Now I'm checking up. What do I have? What's wrong with me? What's going on? I'm talking to everybody I know, driving my wife crazy with all these symptoms. I was obsessing over the symptoms. I had extreme anxiety about the symptoms. I couldn't sleep. I was waking up. I was just so stressed out at this point. So I go in this massive, body all tenses up. I go to the hospital not knowing what was going on. And they said, oh, your condition's getting worse. So they did a biopsy. And the biopsy confirmed I actually had sarcoidosis. So sarcoidosis is not, it can kill you, but not likely to. Usually presents in the lungs and the spleen, which is where I had it. And it's basically what your body does. The immune system cells collect. They can be sores on your skin, nodules. They can be nodules in the body. They're called granulomas. And they can, it's inflammation in the body. Is
chronic inflammation, yeah.
And what they did is they began treating me on prednisone. And they began treating me with very, very high dose of prednisone. So I started out in the hospital on probably 60 milligrams a day of prednisone, came out at 40, and over time tapered down to 5. Now, by the end of that year, I tapered down to 5, but I was so messed up. I didn't know about the effects of prednisone then.
Bad.
A year later, I read a book about all this. I'm like, oh my God, totally makes sense now. But I was riding the subway to work. I was living in the city, and all of a sudden, felt everything tighten up again. I was extremely short of breath. I'm getting dizzy, sweating, and I get off the train, I take a cab and go to the hospital. They said, oh, your sarcoidosis is relapsing. We have to put you back on high doses of prednisone. They threw me back up to 60
around
milligrams.
And around you go.
Around. And this continued. And I went months from that point on, the first 6 months of that following year, going up and down in prednisone,
which
other
can
types
make you
of drugs.
psychotic.
They were giving me inhalers, and he told me, just puff the inhaler as much as you need to, because I thought I was short of breath. I was having a panic attack.
Right.
So I'm having panic attacks, taking prednisone at 40 to 60 milligrams, and puffing a butyral inhaler 10 times a day.
Yeah.
And drinking coffee.
So, but if you think about your trauma, right? If you think about your trauma, this is where the trauma meets the adult, which meets the experience. And we talked about this earlier. And I think the experience is made manifest by the expectation that you're going to continue to have these symptoms. The prednisone exacerbated everything
big
and
time.
magnified everything.
If you've never been on prednisone, you got to look that up because
So-
you won't believe it unless you've been on it.
Yeah, no, it's bad. So the trauma
It
meets
was
the
like
adult.
cocaine. I felt like I had done cocaine when I was younger. I literally felt like I was on cocaine.
Yeah, no, you're
Yeah.
wigged out on this stuff.
Right.
So the trauma meets the adult, and the experience is made manifest based on the expectation that creates the perception that unless I'm sick, I'm not being seen. If I have an illness, they can't ignore me.
Yes.
Which is what happened to you when you were a child.
Yes.
So, and around you went in this vicious cycle
Right.
of the trauma meets the experience of, like, I don't feel like I'm being seen. No one's going to pay any attention to me unless I'm actually sick. So that manifests these or exacerbates or magnifies the symptoms that you're having. That's what I think was happening. I know we talked about this yesterday.
Yeah.
But I feel like what's going on then? Is it SSD?
And I craved it at that time.
Right. 'Cause you were getting a lot of attention.
I felt safe when I got to a hospital. I felt like, because at the hospital,
Right, that's
guess
safe.
what?
Right.
They're going to stick needles in me, and they're going to ask me how I'm feeling.
Right.
They're going to run tests. They're going to check on me, right? And guess what? I actually had a real condition.
Yeah. So
I actually had
that
sarcoidosis.
validated, but
Right.
it doesn't sarcoidosis. You can have sarcoidosis. It's usually
It's usually an
asymptomatic.
accidental find.
Right.
Right.
But it's usually not symptomatic.
Again, I
Or
started,
it has nothing to do with what you're feeling.
And I'll fast forward for everyone here that ultimately, when the dust settled on this, I went and got a massage for the first time in my life. The massage therapist, by the way, I got an hour massage for $40. Oh my God, inflation. But
Yeah.
I got this excellent massage in New Paltz, New York. And she said, your back is full of knots. I've never seen so many knots in someone's back, she said.
Yeah. So you were so wound up and
And
tight.
she said, did nobody ever touch you? Did no doctor ever touch you and feel your back or anything? I said, no.
Nobody touched. Nobody touched you.
Nobody touched me. Nobody felt
Nobody
anything.
palpated
All
anything?
They did,
Did
no,
not-
they didn't palpate me. All they did was give me drugs and do CAT scans and x-rays
That's
and
insane.
MRIs and everything known to man.
Right, but they didn't touch your skin. They didn't try to
No.
feel anything was
And
going
that
on.
was the thing. And the wildest thing is I had a test and I was supposed to go to Hawaii. We actually went to Hawaii in April, and that's a whole story for another day, how I got there, the drugs I was on to get me on that plane and through that vacation. But and I have a picture of myself from that. I mean, I am
my
swollen up
God.
like the
Yeah, you're probably like a
Marshmallow
tick.
Man
Yeah.
from Ghostbusters. But I said to a doctor, I said, I don't know how I'm going to Hawaii like this. He said to me, that's what you need to do. You need to get out of here. You need to have a few drinks. Go to Hawaii, get yourself drunk. This is what the doctor said.
Can you imagine a doctor
My mother
giving
was
you?
an alcoholic, and he told me to go have a few drinks, and I would be right as rain. That's just all I needed. All you
need is a few drinks. That's a great prescription.
Yeah,
What the
from
hell?
an ER doctor. So,
Well, like these
but,
ER doctors.
you know, but I sought out, and kudos to my ex-wife. She found a therapist for me. Said, if you don't go to this therapist, I'm leaving you. After I got through therapy, I left her. That's another story for another day. But, you know, this therapist helped me see how all the things, again, the trauma met these
The
physical.
adult, right.
So while all this may have been solved by a simple massage at the beginning, I may not have ever known I had sarcoidosis. 'Cause I may not have had none of these tests may not have been necessary. If somebody just massaged my back.
Yeah, but it also brought you to get good therapy, which is probably what you needed from the
There's
beginning.
no regret here at all. I'm
Yeah.
not saying anything should have happened
Right.
or wishing.
Yes.
I never do that anyway because, but I clearly see the connection to your point about not being validated, being ignored, not seen, not heard as a child, and how this happened.
Yeah.
Right? There was all this. It was like a perfect storm, right, of a situation where the only person who saw me and heard me and protected me in my life, I felt, was my grandmother. She died. I got this.
You got really sick
all
and you were
sick,
seeking to
stress
get
in my
validated
body.
and
it came at the perfect time. It was a perfect storm. And really what might have started as a simple stress related muscle tension ballooned into all of this.
yeah.
But most people put aside whatever is going on, and some people don't take their symptoms serious enough.
No, yeah.
Right. And so you have to be balanced, right? And
Well,
if you
that's
can't
it.
say, well, I've had this pain in my abdomen for 6 weeks, probably just, constipation comes with age, right?
Well, that's what
So you
I
don't
do.
ignore
Yeah,
things either.
that's where I come from. I mean, I come from a family who did ignore things, who didn't talk about it. You bucked up, Buttercup. I mean, that's what you did. And you didn't really talk about physical symptoms. I mean, if I was sick, I never was ignored. I mean, I was sick, right? So because I wasn't a complainer, like if I felt something, usually I didn't complain unless it was really bad. And, then I would be taken to the doctor. I mean, I didn't have the same issue, but on the other end of that spectrum, we didn't talk about it. And even now, like I'll feel things and things will happen, go on and on for a long time. And I just will ignore it. Like, oh, it's fine. It's fine. It's just my heart, whatever. And then finally to the point where I can't sleep, like with the heart thing, I was having heart palpitations for a long time.
So you do want to get things checked out.
Right. So I finally did get it checked out, and thankfully it's nothing, but this is what I would do. So it's interesting. We have like you're at one end and I'm at the other. So we kind of come together in a balance, because I don't talk about things like that. Like I'll have an ache, a pain. I mean, I feel stuff every day and I was like, I ignore it. Like I'm fine. It's nothing until like it becomes so chronic that I can't ignore it anymore. And, maybe if I address it sooner, but I think with the heart palpitations, I started when I was in menopause, and I just ignored it until it just got so bad.
And a lot of people, we both had COVID 3 years ago, right? So a lot of people are having things related to COVID now that they didn't have before, like heart issues.
That's it.
Those are real issues, right? But how you respond to it is what's at issue here. And I also find, too, that when I experience significant stress in my life, physical symptoms show up. And sarcoidosis, I think,
is a stress
can be
response.
manifest from a stress response.
Well, it's chronic inflammation. Inflammation like that can cause a lot of disease in the body. That's what causes disease in the body, is inflammation.
So before we close, why don't you share with the audience some things you told me before we got started here about good supplements that help people with inflammation or guard against inflammation.
Right. So there's a lot of things you can do. I mean, I just looked it up. Look, I'm no doctor. This is just how I live my life.
Advice.
No, not medical advice. But I mean, things that I do for myself that I know keep me healthy and strong and migraine free and pain free typically, are a good diet. And that means like, I can't eat gluten, right? I can eat gluten, but when I do, I suffer the consequences. Right. I'll get a migraine. I'll have inflammation in my joints. Things like chocolate, forget about it. Like I love chocolate, but I had to give it up. So
I love Easter candy.
Candy. Like I don't eat candy or anything like that. But I have to really be careful with the sugar intake.
Yes.
So I keep my sugar to 20 milligrams a day or less.
Good.
And that does help a lot and takes weight off. But with the supplements, things like curcumin, turmeric, bromelain, vitamin D, absolutely. And there was something else. I know bromelaine's a big one.
We'll post it for you.
We'll post it. But there was like 4 of them that obviously check with your doctor, make sure they don't interact with any medications.
Right. Don't do anything without the advice of a medical professional.
Yeah. But these are things like if you have something like sarcoidosis or you tend to get chronic inflammation due to stress, number one, address the stress. Sleep is number one. Like you really have to make sure you get a good night's sleep, because that, if you don't sleep well, it will affect every area of your life and it will make you sick and it will cause inflammation and all that, those other things. So sleep is number one. Make sure you have good sleep hygiene, exercise, stress management, like meditation or whatever you do, walking in nature will help with inflammation, and, whole food diet.
Right.
If you can't kill it and you can't grow it, don't eat it. That's my rule.
Okay. So if you have an experience like the one I shared, please share with us, or feel free to email us at changingtheworldwithinus@gmail.com. Visit our Instagram page, private message us there, Personal Transformation EXP. If you found this podcast helpful, please subscribe, share it with others. hit the like button that shows the YouTube world that we added value to the ecosystem, the podcast ecosystem, which is quite large. And thank you for watching us. And stay tuned for the next episode, and have a great week.